contains blood-forming stem cells, and stem cells are defined as a simple cell in the body that is able to develop into various kinds of cells, such as blood cells, skin cells, etc. And how stem cells work is it's basically to like replenish white blood cells that are lost through either the cancer fighting the white blood cells, or if it's the chemotherapy or radiation killing off white blood cells. So the chemotherapy and radiation kills patients' white blood cells. Doctors collect healthy blood-forming cells from the donor, and then the patients receive the healthy blood stem cells through transplants. And then that will increase the patient's white blood cell count to replenished by stem cells. And doctors are then able to continue and increase the amount of chemotherapy and radiation to help fight blood cancer.
Alright, so the organization that we chose to talk about in regards to bone marrow registration is Be the Match. The main purpose of Be the Match is to connect these patients with life-threatening diseases with donors that are in the registry. And one of the main things also is that they provide support for patients and their families. One way they do this is by offering financial aid programs in case one of the families can't pay for it easily. Another aspect is that they provide education for healthcare providers. They also conduct research. This is important because Be the Match collects funds to try and conduct research to better improve their transplant processes. They also raise funds to further success and improve transplants. This is crucial because, like I said, it can be expensive to go through one of these transplants, and by increasing funds, it makes it more easier to pay for these if a family, has trouble paying for the transplant. And then lastly, I'm going to talk about the importance. So right now there's 24.5 million people that are potential donors in the registry, and this number is huge. It's a large number, but unfortunately it's not enough. The probability that a patient is able to find a donor with a perfect match bone marrow is only 66 to 97% of the time. So even though this is a huge number and most patients are able to find a match, there are still some who aren't able to find a match. So the best way to try and combat this is just to get more people to throw funds towards Be the Match's way and just get more people to register.
Okay, I'll be talking about registration, the donation process, and how you become a match for people. So you can register online at Be the Match. There is a $100 fee that they will charge, but if you're a student here at Iowa, you can contact the hospital and they will cover the $100 for you. So that's something the University of Iowa does for us that makes it easier for us to register, as well as just how easy it is to register. You will be given a packet where you swab both sides of your mouth for 30 seconds, and then you just mail back your swabs, and it's sent to the lab. You just have to fill out your basic information and make sure to update the information online, say when you move, or say your phone number changes, just so they can keep track of you. And so, how do you become a match? So 1 in 40 members of Be the Match registry are contacted as a potential match for someone, but only 1 in 540 actually donate their bone marrow. So when you are contacted about being a potential match, you are asked to confirm your commitment to the donation process. And when you do so, you may be contacted in a few weeks about further testing. These tests include things that will make sure that it's safe for you, safe for the donor, safe for the patient, and make sure that you are that perfect match for them. And when you are that perfect match, the donation will go through and the donation will happen. And so there are 2 types of donations: bone marrow extraction and peripheral blood stem cells. The direct extraction is a surgical procedure where your bone marrow is extracted directly from your pelvic bone. And peripheral blood stem cells is a blood work process, a 2-way system where the machine draws your blood, they extract the stem cells, and then you are given back your blood. This goes in either a 1 8-hour session or 2 4-hour sessions. And post-donation. So many of the patients and donors like to meet each other after the after the process is complete. And in that first year, only anonymous contact is allowed. Cards, gifts, small things like that, just to keep things safe. But then after that year, with consent, personal contact and meeting them and stuff is actually encouraged. So we're going to talk about some post stories.
Yeah, so you might be sitting there thinking like, okay, if I donate, there's no chance that it's actually going to save a life. And it's very important just to get it out there, just in case, similar to this story, that it can be a 10 out of 10 match. This little girl, Clara, was born, and for her first birthday, she was diagnosed with a very specific type of leukemia, and it's kind of increased her risk of not surviving due to infections at such a young age. And then we have John. He had registered, and it turned out that they were a 10 out of 10 match, which is quite rare, but it just took that one guy to save this little girl's life. And after a month after her transplant, the stem cells started to graft with Claire, and she was sent home from the hospital a month later. So kind of see how it really wraps up, even though these statistics seem a little grand, that you'd actually make a difference. We're excited.
Those are our resources.
And,
Any questions?
Do I need to donate?
I am registered, but I have not been contacted or
Okay.
anything like that.
So, I believe you said something about it's expensive to get the bone marrow transplant, and so that's.
As in the actual donation?
So not the $100 fee, but to actually have the.
The process of having your bone marrow extracted? Yes.
Do you know how much that costs?
We tried to look this up earlier. It really depends on each case, but like if you're the donor, you're not charged anything if that is what you were wondering.
Yeah,
It's all the medical bills.
like all the insurance covers it.
Yes.
Okay. I was just curious how much it cost, actually. I'm sure it's not cheap.
No.
Yeah, okay. Is there a preferred way that they do between the extraction and the?
Once again, it's case to case, but lately they've been trying to use the peripheral blood stem cells more because the direct extraction kind of scares people off, even from registering and stuff like that. So I think that's one way they're trying to get more people to register, kind of explain like it's not exactly always a direct extraction, but they definitely still use that process. It just kind of depends case to case what is the better process. Yeah.
Do you happen to know the numbers on that, like how many
How?
extractions there are versus purple extractions?
I do not. I know, just kind of like what I said, they're increasing the peripheral blood stem cells more because the science behind it, they're learning a lot more. And I assume it'll be primarily that in the future, but I'm sorry, I don't know the exact numbers.
Do you guys know what the recovery process is if you get I'm sort of queasy just thinking about how painful that could be.
Yeah.
Like, is there recovery from that? Like, you have any idea what that process looks like, or not actually looks like, but
It's a pretty, I wouldn't say lengthy recovery, but I don't think in the next couple days or maybe even up to a week, you're not supposed to walk on it because it's a pretty heavy bruise, I know. And I think you're supposed to stay in the hospital for sometimes up to a week just to recover so they know that you're doing all right. And I think it probably depends on how susceptible you are to the process.
So could that be the kind of question that if a donor's contacted, say, can I get the blood drawn versus the hip drill?
Exactly.
Okay.
Is there a student club or organization that's trying to get donors or anything like that? at the
Yeah,
university, or?
It's very new. My friend is actually the vice president, and the name is slipping me, but I think it was started in the past year.
Okay, cool.
Like wish I knew the name.
That's okay.
Wish I could tell you, but it's a new at the University of Iowa campus.
That's awesome. How long did it take the four of you to agree on this topic? Was it pretty?
Day one.
Yeah, it's pretty quick.
Was it pretty quick?
Yeah, no, we had a couple ideas in mind, but Niall had some personal connections as far as his friend and registering, so I thought that was good too, because it's really something that we don't hear on a day-to-day basis, but just like we should, and it make a difference for someone.
Cool.
Anyone else? Thank you.
Thank you.